So good evening, everyone. Today we have got Dr. Rakesh, who will be sharing his case with all of us. So over to Dr. Rakesh, please, sir.
Thank you, Dr. Pawan. So we have a difficult case. In fact, he is Dr. A. He is a general surgeon and a very good friend of mine, 62 years old. And he was an occasional smoker during his medical college days. So since 1984, he is smoking 20 to 25 cigarettes per day. So in 2016, Lichen Planus was detected in it was detected in his mouth and was asked to quit and was put on Varenicline, and he quit smoking for about 2 months. After remaining quitted for 2 months till 4th December, so he had been continuously using 20 to 25 cigarettes per day. He was operated upon for hernia and fracture elbow about 20 years ago. For backache, he is using Pregabalin. And for antidepressants, he said he's using antidepressant for 3 days when I met him about a month ago, but I'm not sure. So he came to me and he was prepared to quit by 5th December. I think it was the last week of November. He came to me and he said he will quit by 5th December. So I advised him some normal home remedies like ginger, then homemade herbal tea and cinnamon. So he started using that. Tulsi also I suggested, and he started using them. And he said he's cutting down the cigarettes. And when the time came, so he said he's cut down to 10 cigarettes.
Okay.
So on examination, his mouth opening was 3 fingers, but he did not allow oral examination. So I asked him to use nicotine patch, 14 milligram. But instead of on shoulder, he said it is very hairy and he used it on thigh. And after using one patch, the next day he had nausea, vomiting. And so he said, okay, I'll not use it again. So next time I told him to use it on shoulder. So maybe 2-3 days after that, after the 5th of December, he used on shoulder and he was not having any symptoms. But his wife told me that he just used it once, but he continued to use cigarettes. And he used patch on 7th December over the arm and did not have any problem. But he stopped patches and started using cigarettes again because of the cravings. He had headache, constipation, and symptoms suggestive of depression. Was not picking my phone since 7th December, and his wife reported that he is using about 10 cigarettes per day. But today I tried contacting him. He did not pick my phone. Even his wife did not pick the phone. So I have suggested advice to avoid nagging and support him in quitting. So whenever he decides again. So this was about 2 weeks ago. I talked to his wife and told him that you should not be worried because it is very difficult to quit and stop nagging. So that was the end of the story actually. And so I've lost contact with him now. So it is open for discussion.
Yeah, thank you, sir. I think this is really, really very interesting. And so it's open for discussion. Let's have views from everyone.
So since he was diagnosed with Lichen Planus, I feel stress is a major etiological factor here. And maybe something stress which he is unable to tell the other person. And because of which he is taking more cigarette consumption has increased now. Though he is on tobacco quit cessation therapy, but maybe because of the stress, he is again going the wrong way.
Okay, that's a very important input. Yes, others.
Sir, we have to discuss about ABCD. We have to focus about ABCD of the management.
Yeah.
Active motivation, behavioral therapy, then comorbidity and drug therapy.
Sir, continuous counseling should be done, sir. For every roadblocks has to be removed by removed.
And trigger points. We have to find out the trigger points.
Yes, very important. Very important.
Yeah.
What are the triggers? Okay.
So we can try and do the 7 Ds.
7 days,
Yeah.
of course, yes. 7 days of behavioral therapy, yes.
Yes, sir.
Sir, वो pregabalin क्यों ले रहा है sir?
For back pain.
Sir, only back pain or any neurological disorder?
No, it is only for the backache.
So that's basically pregabalin is basically for neurological pain.
Yes,
And
sir.
so basically, since this treatment has to go along with a psychiatrist also, because he's under depression also. So considering the ABCD format, the C comorbidities, we have to go along with a psychiatrist.
I just forgot to tell him he is diabetic also. Why
Okay.
Okay.
he's under treatment for that also.
Sir, first we have to talk with him, sir, regarding what are the roadblocks he has in his anxiety or anything is running in his mind.
True. Anything?
And what are the what are the withdrawal symptoms when
withdrawal
he left?
symptoms? He had
Yeah.
tried once.
Yeah. So
But it
why
has got
he
corrected, no, sir?
Yeah.
why he started again? What he
It started again. Yes.
Another thing, he's also using alcohol also every day, maybe 2-3 packs every day.
Okay.
That's another complex situation.
Yeah, yeah.
Yes.
I think that's a trigger point. Alcohol, along with alcohol, he wants
So
it.
only alcohol or any other drugs, sir?
No other drug. As far as I know, no other drug. Alcohol and
Sir, I think playing it in a scientific way would help, like making logical, as in telling him like अभी जैसे वो थाई का जो हो गया था कि थाई पे NRT डाल दिया था. So if we explain, like when we got that कि अरे first pass metabolism के वजह से you were getting this symptoms, maybe that would have made him accept the patch a little bit better. I think he is not comfortable using the patch or any medicines for that matter. So we need to address ki without the medicine, this will be a difficult journey. Medicines are supposed to aid you in this. So whatever inhibition is there about using medicines or patches, maybe we need to overcome that with him in any sense.
He has not confidence in the medication. He
Yes,
lost
yes.
confidence because he had the vomiting, and also now he doesn't want. Okay.
and earlier actually he used
Well,
Varenicline.
that also he didn't like. Yeah. So I think उसको medicine से अभी he is blocked. Like I don't want to use वाला zone में.
So Archana ने जो बताया ना, we have to go to A, B, C, D of tobacco association. That is the most important. But look at the whole case scenario. Just look at the whole case scenario. Number one, what is the biggest roadblock here? What is the biggest roadblock?
He stopped responding now.
See, Dr. Rakesh had a wonderful dear friend, and because of his intervention, now he has lost a contact with his most dearest friend. Right. So this is a one thing that we don't want in our life. No? We don't want to lose contact or connect with our friends. If the friend themselves they stop connecting with us, that means we are losing, or we are somewhere we are going wrong. Right. This is somewhere we are really. So what is the biggest block here? See, you see, what is the biggest block is that
Lack of confidence in him, sir.
Yes, sir, he's ashamed to admit that he started again because sir is also a friend that way.
Yeah, I think Monalee is right. He's quite ashamed of himself, of his behavior.
He's ashamed of himself, or we have actually somewhere we have played it wrongly. Our communication skills somewhere has gone wrong.
The rapport between the patient is not built up properly, I feel.
Yes. So number one, let us go from the beginning itself, right? So there was no commitment from him. Actually, he wanted to quit, but he did not commit to quit.
Yes.
Right? He just took it for granted कि हाँ ठीक है डॉक्टर राकेश बोल देंगे वो कर लेंगे ऐसे कर लेंगे वैसे कर लेंगे. He did not have the confidence, or he did not have the commitment. Right? Number one. Number two, probably a friend will not like to, if a person, because the other person will become judgmental, right? This has to be non-judgmental. This has to be non-judgmental, like a third person who is completely not
Unknown.
interfering, unknown, interfering into his life. Because you see, a lot of issues, the triggers, lot of issues would be there, which would be his personal, and he may not like to talk to a person who might be knowing him, or who might become judgmental,
Yes, sir.
right? So here what is important is we need a commitment from him, but we at the same time, the doctor for him should be a non-judgmental, that means a third person,
Okay.
right? Completely different, completely different. Like if I have a friend who wants to quit tobacco, I will not do it. I would rather give it to Dr. Rakesh, or I'll like to give it to Dr. Monalee or someone else like Dr. Durga or someone, rather than myself doing the counseling, right? अच्छा, अब दूसरी बात क्या है कि our communication should be such on a continuous basis without, मतलब जो हम बोलते हैं ना, a person will become silent or violent, right? If he's not comfortable, he's not in the comfortable zone with Dr. Rakesh to come out with clarity ki what he is going through, or what he wants, or what has gone wrong. Even if a person goes, even if there is a sleep, there is a relapse, still our rapport should be such that the person will come back and say, Dr. Pawan, I have not been able to do it. I need your help. Or these things went wrong. I need your help. So that type of a communication has to be there, right? So यहाँ पे from the see, I am also not very accepting the fact that he's putting that patch on the thighs would have caused vomiting and this thing. There might have been some other reason which we have not been able to check, because if there was a first-hand metabolism, on the contrary, the nicotine level would go down. There would not be much of an effect of the nicotine in the body, rather than causing such symptoms, right? So there was some other thing which we need to diagnose what was actually went wrong with that person, right? So these are certain aspects that we need to, so we need to understand. And the most important is means now building up the rapport with that person and assigning him to a third person, maybe on a virtual clinic, on a virtual these things, assigning it to a third person who will be totally non-judgmental, and also taking the wife into confidence. The spouse, the children also need to be taken into confidence. They should be a part of the body, and active motivation, that is what would be required for him, right? Right now,
So you meant to say quit buddy?
Yeah, quit buddy. The wife, we need to have the spouse or someone, who would be a friend and who would not be nagging, who would not be scolding, who would not be telling him, but on the contrary, would be a friend. There are a lot of factors which are actually adding to him, like he's using alcohol on the continuous basis. He's using alcohol. So you see, whenever we would actually, you see, when the person is taking 20 to 25 cigarettes, it is easy to go gradually. It will be very easy for the person to come down to 10, even to 5. But then that 5 cigarettes ko hatana bada mushkil hai. Now what happens is, after that, once he has come down to a substantially low level, after that, we will have to start working with the triggers. What are the triggers? We will have to draw a daily routine, right? What time he gets up, what time he gets up at 6 o'clock, and what does he does, what is the first cigarette, when is the second cigarette, when is the third cigarette, when is the fourth cigarette, when is the fifth cigarette. And then for each point, right, we will ask him, after we have drawn this thing, what will be the best, means which would be the most, which one he can quit, right? So then we will start getting it out of his life, one by one we'll get out of his life. But at some point of time, it will come when we will have to tell him that, look, now you have to go cold turkey. Now you have to go cold turkey. But at the same time, would have, by that time we would have understood what is the amount of nicotine he requires, the patches that he requires, whether he requires 14 or he requires 7 or he requires 21. So once we have managed the patches, once he has totally gone zero for almost like 2 weeks, and he is now his habits, actually the nicotine patches and nicotine gums and nicotine lozenges, they are here to manage the nicotine levels in the body, which will give him the withdrawal symptoms and the cravings that can be. Cravings will be of two types: the psychological cravings as well as and the physical cravings. The physical cravings can be taken care with the patches and lozenges, but the psychological cravings के लिए you will have to talk with every triggers. क्या होता है, सवेरे अगर तुमको उठ करके वॉशरूम जाना होता है जिसके लिए तुमको ट्रिगर होता है, then you will have to change the system, or you give him some Dupalac, or you give him some
Glass of water.
No, not just glass of water, some medical therapy like Isabgol or something, so that he will have some laxative, so which will be of help to him, and he will get the confidence. हाँ ठीक है, मेरा तो हो जाएगा. I'm okay with that, right? So that is something we'll have to take each of his triggers. The medical, if he's not having sleep, अच्छा. अब another point is that अब when he says that कि alcohol के साथ में मेरे को लेना पड़ता है, we'll have to give him something, some alternate, like alternate क्या हो सकता है? We can give him a acapella, right? Acapella is a alternate to smoking, like he has to suck in and he has to pick up. But what happens is when he sucks in, his lungs gets expanded, right? So acapella is something that we'll have to give some alternative, because smoking alternative acapella jaisa hai, which actually helps in the for the, like, it gives a same feeling like he's smoking, right? He's pulling the smoke, into. So that way we'll have to give some alternative. We have to actually, right now the difficult part is accepting. Dr. Rakesh, maybe we'll have to accept and tell him that, look, I have a friend, I think who will be able to help you out, and it would be better if we can discuss with him. I think there might be certain things that would be, and probably you might, and right now तो उसको हमें accept कर लेना है कि जैसे तुम हो वैसे ही, you are good, and I would love to be your friend. It doesn't matter whether you're or you're not. Now, it doesn't matter. You're still my friend. Now, अब तो हमें रैपो सबसे पहले तो उसके साथ चलना पड़ेगा, कि accept करना पड़ेगा. He also starts accepting. अरे, I did not want to talk to you because अब पता है मेरे को तुम, या फिर से तुम मेरे को बोलोगे मैंने तो छोड़ा नहीं, मेरे को हुआ नहीं, ठीक है ना? तो उसको सबसे पहले तो उसको build up करना पड़ेगा. Back to the square one, and we accept him that okay, you have a relapse, no problem. And कोई बात नहीं है, नहीं छूटा, कोई बात नहीं है, we will try sometime later. अभी तो कुछ दिन के लिए उसको ना ढील डाल देनी, उसके पीछे नहीं पड़ना है. Let him feel happy with what he is right now, ठीक है ना? क्योंकि अभी पीछे पड़ने से वो बिल्कुल आपको बात नहीं मानने वाला, ठीक है? आपसे दोस्ती तोड़ लेगा, आपसे सब कुछ कर लेगा, बट वो आपकी बात नहीं मानेगा. And once he is okay ना, once he starts coming back and starts talking to you, वाइफ को भी बोल दीजिए, उसको वाइफ को भी बोल दीजिए, इट्स ओके, अभी थोड़ा सा शांत रहो, कुछ नहीं बोलने की है. Let him continue to take. Let him build up that confidence. Now, building up the confidence is right now is very difficult right now, but let him build up that feeling that okay, now everyone is सब शांत हो गए हैं, अब मैं अपने बिल से वापस आ सकता हूँ, लेकिन अपने बिल से निकल सकता हूँ. नहीं तो सब लोग मेरे पर फिर झपटा मारेंगे. मैं जैसे भी मैं राकेश को फोन करूँ, वो मेरे को झपटा मारेगा. तूने छोड़ा क्यों नहीं, क्या है, पागल हो गया तू, समझता क्यों नहीं है, ठीक है ना? तो वो आपसे बात, कोई नहीं चाहता कि मेरे को कोई डांटे. No one wants someone to scold me. No one is ready. I am a grown up child. मेरे को क्या बच्चा समझ के रखे हो क्या? मेरे को कैसे बोल रहे हो? जब मेरे को छोड़ना होगा मैं छोड़ दूंगा. मेरे को क्या बच्चा समझ के रखे हो तुम लोग? This would be his attitude, and he's a learned person. He's a doctor. He's a learned person. So we'll have to go slow with him. We'll have to now build up a relationship with him, and slowly and steadily we'll have to talk scientifically with him. All the medical, the pathology of nicotine will have to make him understand, because he's a doctor and he understands everything. He knows that it is harming him. He knows that this is, but his life situation is such where he is not able to cope up with his life situation. So हमें वो aspect भी हमें उसको देखना पड़ेगा, and we'll have to work out with him. A psychologist,
सर फर्स्ट काउंसलिंग करने के लिए ठीक है सर, ही इज ऑलरेडी अंडर डिप्रेशन, सो तब
his depression cannot be solved by just antidepressant.
yes sir,
Yes,
So
to
the
talk
root
to
cause
psychologist,
should be corrected.
yes, the cause needs to be corrected. We need to understand he wants to let out he wants to vent out all his feelings to
Yes sir.
someone who will not be judging him,
Judgmental.
will not be judgmental. He has to vent out. If he vents out his feelings, he vents out everything, then only he will be able to,
Listen.
he will be able to take the life, or he will be able to see the real path, what will help him in the future, right? So wo jab tak uska vent out nahi hoga, so these, building up the confidence, getting a commitment will have to wait, but right now we have to build up the rapport, make him comfortable, that is what I had said in the communication. Whenever you communicate, the person should feel comfortable. He should not go silent or violent. Right now he has gone silent,
Yeah.
right? Because he's not comfortable. So we'll have to build up that comfort zone for him, right? That is the first thing that we need to do, right? Teri life hai, tera cheez hai, you are there, I am with you, whatever you do, I am still with you. Okay, now let us work out. ठीक है ना? And then we will work out कि क्या medications देना है, क्या करना है. अभी तो कोई चीज नहीं काम करना, अभी तो उसको जैसे भी है. And then we ask a third person, or we can go virtual, and then we will talk to him, and then we will take it. ठीक है?
Okay.
Does it make sense? और मैंने कुछ
ठीक बोला सर.
Yes sir, बराबर.
Yes. absolutely.
सर
तो-
इसमें क्विट बडी अगर वाइफ है तो उनको क्या हमने एडवाइस देनी चाहिए, लाइक बिकॉज शी इज गोइंग टू गेट irritated by his smoking, and what मतलब what is the support that we are supposed to tell her to give?
See, this is a very important factor, wife and husband, right? अब वाइफ ने तो यही कहना है, इसे तो होता ही नहीं है, इसे तो घटता ही नहीं है, ये तो छोड़ता ही नहीं है. अरे छोड़ना में कितना है, मैं कितनी बार बोल चुकी हूँ, छोड़ते ही नहीं है. बच्चे बोल चुके हैं छोड़ने के लिए, ये बोल चुके हैं छोड़ने के लिए, वो बोल चुके हैं छोड़ने के लिए, सब तो छोड़ता ही नहीं है, right? This is the common thing that a wife will say.
That is it.
And husband will keep on scolding her and telling her कि तू चुप हो जा, मेरे को तू ये परेशान मत कर, मैं को जब छोड़ना मैं छोड़ दूंगा, मेरे को पता है, तेरे को क्या समझ में आती है, right? Now how do you solve this problem? See, if you tell the wife that कि तुम चुप हो जा, तो wife तो चुप नहीं होने वाली है, वो बोलेगी यार मैं तो परेशान हूँ, वो चुप नहीं होगी. हस्बैंड को इरिटेशन हो रहा है वाइफ से कि वो बार बार उसको नैग कर रही है. How do you solve this problem? You see, this is a very, very important aspect that we have to learn. Right? What we have to learn is कि this person, ये जो person है, how he will both see by the means either way, wife or husband, none of them should go into silence or violence.
Okay.
समझ रहे हो ना? So how do you manage this thing? How to manage this thing? See, सबसे पहले हमें दोनों को praise करना है.
Okay.
First thing is that we have to praise. Second thing is we have to tell them the scientific aspect of addiction. Tell her that look, he has come and he wants to quit, right? So right now we have to work out on that, and we have to tell her that why it is so difficult to quit. He is trying to quit. He has been trying to quit, but till date he did not get the right system or the right methodology to quit. So that is why he could not quit. And it is a disease and it needs to be treated. And it is not that he is not willing to quit, right? Second thing, जब वो irritate हो रहा है, अपनी wife के ऊपर irritate हो रहा है, तो husband को समझाना है. Still she is with you, still she is there, she is come with you. Why she has come with you? Why she is still working with you? What for? वो बोलेगा, wife बोलेगी she is concerned, she is this, she is that. That is why वो चाहती नहीं है, ये है वो है. Then you cut it down and just tell one sentence. She is here because she loves you. The moment you say this sentence ना, वो सारा जो इतना बड़ा जो दीवार है ना, इतना जो ब्रेक है ना एकदम से गिर जाएगा, हट से एकदम खत्म. हाँ, yes. And then the wife will feel good, the husband will feel good. ठीक है ना? You see, she's still here just because she loves you. She's trying all this because she loves you, right? All her concerns, all of these things are just because she loves you. Just insist on that. The moment you say this, you know, सारा कुछ खत्म. Everything becomes.
No.
Then the way he will start, just now you imagine how that person is going to look at his wife and how this wife is going to look at his husband. Can you imagine this? सब लड़कियों को तो इमेजिनेशन आ ही जाएगा, हम लोग नहीं पता है. ठीक है ना? Does it make sense? Yeah.
Yes, sir. Yes,
So
sir.
you see, when they will go back, they're not going to fight anymore. Otherwise, they will go back home and she will say, he is going to scold. तेरे को तो सब कुछ बड़बड़ाना था, तेरे को तो सब कुछ बोलना था डॉक्टर के सामने, अरे चुप नहीं रह सकती थी. ठीक है ना? And the husband ऐसा बोलेगा और वाइफ बोलेगी क्यों नहीं बोलूंगी मैं तो सच बोलूंगी ना. ये तो झगड़ा ही हो रहा है ना. But the moment you say that she loves you, अब now when they will go back home, they will go back home hand in hand. Right? Yes. And tell her that look, you have a responsibility. Wife को समझाना है that you have a responsibility. We are going to give you some responsibility. Now when he's trying to quit, you have to help him quit. You will stay. You will not intervene. Now I am there to take care. कोई भी चीज होता है मैं टेक केयर करूंगा, आपको कुछ केयर करने की. You just be a buddy. You just be there to help him, right? As a supporter, as a nice wife, as a lover. ठीक है ना? Right? Just don't nag him, don't scold him, don't do this thing. We will work scientifically. I am here to work scientifically with him. How we will take it further. See, we have to be scientific. We are not going to be here talking like some pandit or someone that कि हम उसके ऊपर माला जप देंगे, ये कर देंगे. We are going to be scientifically talking to him, working with him in each and every aspect, the triggers and everything, so that we will be out of it. चलो और कुछ? I think sir ठीक है ना sir? Dr. Rakesh, anything you have to say?
It's perfect. बट है कि जैसे अभी मैं उसको अप्रोच कर रहा था ना, I was not much after him. I was not after him actually, and I told him that it is not an easy habit to leave. So we are comfortable whenever you decide. So actually he decided about that 5th December date. I never decided about it, but somehow I think there are many issues. There's one issue that actually his son also, he was a smoker when he was in medical college, and he smoked almost 35 to 40 cigarettes a day, but he could leave it, and he appreciated that he could leave it. In fact, that son was after him to leave. And now actually what happens is he had a very good practice, surgical practice, but now since the sons have joined him, he is a little uncomfortable that the financial matters have gone to them. They are not with him. So that may be a part of the reason for depression also. So as Dr. Pawan has said, I think we should wait and watch. Wait for another month or so, and then we'll approach him as a
friend now. As a friend, to talk to him about all those aspects. भाई क्या फर्क पड़ता है इस उम्र में, कैसा है, थोड़ा बहुत तो करना है, let us enjoy life. So we'll have to talk as a friend. You will have to instead of being a doctor for him right now, sir, you have to now become a friend to him and just discuss about all the other aspects which you can actually help him out, right? Other aspects, right. And then when it actually comes to quitting, na, don't do that. बोलना है उसको, बोलना कि अच्छा, I will take you to another doctor, or I will arrange another meeting, or I will arrange something with another doctor who will take it with you to help you to quit. Right. But इस वक्त आप उसके साथ मतलब you will have to just go back as a friend. कि उसके जो जिंदगी में जो बीत रही है, सर ये तो होना ही है. दिस इज अ लाइफ साइकिल. जितना कमा रहे तो थोड़ी अभी उतना ही हम कमाते ही रहेंगे. But yes, you can always tell him that कि okay, now after you have quit, let us work on you. मतलब let us do something socially, right? In the society, हमने तो कमाना था जितना हमने कमा लिया, let us do something socially. Let us work on things, let us do something. हम लोग कुछ करते हैं जिन society ले कुछ करते हैं. See, we can actually engage him. You know, another very important aspect at the elderly age group is when the person starts feeling that he is not worth anymore.
सेल्फ वर्थ का थोड़ा इश्यू लग रहा है,
है ना? तो यहाँ पर हमें उसको हमें एंगेज करना पड़ेगा. We have to boost him up, we have to motivate him up, and life is just not work. Life is so many other things, right? So we'll have to talk to him in a wonderful. See, this counseling is going to take a lot of time. How to engage him, how to take him through his life journey and explaining. It is going to be there. So, and this will actually initial part right now. You will have to work on these aspects. And then we will go back to tobacco cessation.
Actually, he needs services of a psychologist.
Yes.
Right now.
More than psychologist, he needs a friend. A psychologist or hang, but he needs a good friend who can actually talk to him in a very
friendly
understanding.
Who can be a life buddy, not a tobacco buddy, but a life buddy.
Right.
So that is where probably if he is a friend of yours and a good one, then probably this is where you can help him right now. And then when it comes to really tobacco cessation, then we all 10 of us are here to help. 9 of us, if we exclude you. So we are here to help.
I may tell you that actually he was the reason that I joined this course.
Oh wow.
Okay, good, sir.
So now he motivated me to join actually.
Oh, that's wonderful.
Yeah.
So his motivation has actually worked. He has actually motivated you to do something wonderful for the society, for him. So he's looking forward that you will actually work out, give him some solution.
Yeah, sure.
That's a wonderful. I think we have found some way out today, and we will follow it up.